Today we are discussing about the hepatic disorder. We are concentrating about mainly how will you treat with a hepatic disorder patient, what are the drugs we can prescribe for the patient, what are the other problems that are related to hepatic disorder, bleeding tendency, all these. So you must aware of hepatic disorder and you must know about the what are the medications we can prescribe for the particular type of patients and the drug toxicity, everything is the hepatic disorder. The most important times we are going to have drug toxicity because we are early for the particular patient. So, what are the maximum time disorder and what are the bleeding tendency and the main things like viral hepatitis. So that are the main things in concentrating in this topic. First, we are going for the anatomy of the liver and what are the functions of the liver diseases, and the tender medications. Liver is located in the right upper quadrant of the abdominal cavity, resting just below the diaphragm, and it has a size of the around 1.4 to 1.6 kilogram, and the blood supply to the particular is the hepatic artery from the aorta and the portal train. So the main function of the liver is the metabolism, which means carbohydrate, fat, and the protein, and secreted like the bile, bile acid salts, secreted like bilirubin, drug, and toxins. So this is like the albumin coagulation factors. Storage like the vitamins and the carbohydrates, and detoxification like the ammonia and toxins. And these are the main function. So the waste products and the other harmful substances from your body. So it's as a guard against the infection. And it's like a factory that builds the converts of protein and the sugars and stores the vitamins, sugars, fats, and the other nutrients, and release the chemical and the nutrients into the body when they need it. So mainly vitamins like A, D, and B12 are the stored vitamins and maintains the proper level of glucose in the blood. Produce the 80% of your body cholesterol and the storage of glycogen, decomposing the red blood cells, production of the hormones, and produce the insulin. These are the main functions of the liver. So, what are the causes of the liver disease? There are congenital problems are there, and parenchymal and extrahepatic obstructions are there, and the other causes like alcohol abuse, drug abuse, and the hepatitis infection. Congenital problems like RH incapability, prematurity, atresia, Tourette syndrome. These are the common things. Parenchymal like viral hepatitis, chronic hepatitis, cirrhosis, primary biliary cirrhosis, drug-induced hepatitis. Extrahepatic like gallstones, carcinoma of the pancreas, and the other related injury. Mainly, we can see the alcohol abuse and drug abuse because if the patient never go for to meet the doctor and the patient taking their own medicines like painkiller like that will induce the uh, liver disease and the hepatitis virus infection. So normally how will you manage for if the patient came to our dental clinic, what are the things you will do for the hepatitis patient? First, you will take the history of patient. So we can see in the patients with the yellow discoloration on the skin and the sclera, and there will be in the increased serum bilirubin, that is more than 50 micromole. So, and the patient having the bleeding tendency, cirrhosis of the liver tumors, reactions to the medication, and will be liver surgery, hepatic surgery, and family disorders. These are the. So, what are the signs and symptoms we can see in the patient of liver disease? Repeated contraction, the patient's left hand, we can see the diagram, there will be contraction of the finger, and a palmar erythema, there will be palms, we can see the reddish appearance, and the finger clipping will be there. Then leukopenia, you can see in the nail, parotid enlargement, jaundice, spider nevy on the abdomen or the skin regions, gynecomastia, then ankle edema, scratch marks. These are the commonly seen of signs and symptoms seen on the liver disease patients. So, what are the tests we'll go for the liver disease patient? The main things are select bilirubin level. It is greater than 17 micromole, and aminotransferase enzymes like aspartate aminotransferase and aminotransferase like ALT and AST. Alkaline phosphorus like 25 to 115. Gamma glutamate transferase and prothrombin time and international ordinance ratio INR value. That is the most important things we go for the liver disease patients. The factors affecting the dental treatment, that is lateral toxicity, bleeding tendency, and the viral hepatitis. So main thing in the bleeding tendency, the clotting factors, that is the most important one. Clotting factors like 2, 5, 7, 9, and 10 are deficient in the liver disease patients, and the prothrombin time will be changed, and proton time measures the extensive pathway and the normal range around 10 to 12 seconds. The INR is the proton time ratio obtained using the internalized reference component reagent. So INR range will be 0.9 to 1.2, average is around 1. So if the bleeding in a person, you can see the patient's value will be 1.5. So what will happen is the coagulation will be disturbed, elevation of the INR value, and elevated fibrogen, low platelets, elevated dimmer, like that. So there will be spontaneous and bleeding will be there. Alteration in the liver disease affect the whole spectrum of the coagulation factors as compared to a single deficiency. So it's like a deficiency of the coagulation factors and anticoagulant factors and likely balance. So there will be hemostatic phenotype is likely to change the psychological variations such as renal failure and inflammation. So routine blood tests we can never find out the problems. That's why we are going for value for these things. INR value is the platelet prothrombin time divided by the controlled prothrombin time. So what the prescribing the drugs for the liver disease patient is very important, because normally we can never give the normal NSAID drugs, antibiotics, and muscle relaxants, all these things, because that will lead to the drug toxicity and it will affect the kidney. So we'll send the patient for the physician opinion, then only we can prescribe the drugs to the particular type of patient. What are the drugs contraindicated and the alternate drugs we can give for the patient? Analgesics like analgesics are commonly used for the dental treatment. So aspirin, codeine, mefenmic acid, NSAIDs, opiates, paracetamol, all these drugs are likely contraindicated for the patients. The alternate like drugs we can give the silicoxib or hydrocon oxycodone, like that we can prescribe for the patients like liver disease patients. Antimicrobials commonly used like azithromycin, clindamycin, tetracycline, metronidazole, erythromycin. These are the drugs commonly aminoglycosides. They are commonly used for the dental treatment. So these drugs are contraindicated for the particular type of patients. So what are the alternative drugs we can give? Is like amoxicillin, ampicillin, cephalosporin, penicillin. These are the commonly drugs we can give to the particular type of, but the dosage is very important for this type of the patients. And muscle relaxation is the monoamine oxidase inhibitors, the hexamethionine. So the drugs like vicuronium, pancuronium, metriconium, like that, the drugs we can prescribe for the patients. And the other thing, the local anesthetic drug for the liver disease patients is very important. So mostly we are using the 2% lidocaine, 1 is to 1 lakh. No? So maximum usually 2 ampules for the hepatitis or cirrhosis patients. So what is the main thing? No, the amide atoms can occur with the significant liver disease. So liver disease does not increase the duration of the amides, and dental treatment with the cirrhosis must be completed over multiple visits to minimize the total amount of the local anesthetic used per visit. So for the degree of the liver disease patient, so we will give maximum 2 ampules. If we giving more than 2 ampules in the books they mentioned, okay, we can give for a maximum dosage of for the patients like around 12 to 40. But in the hepatic disorder patients, we will give only maximum dosage is around 2 ampules. That is very important. So the same thing like 4% alkane, 4% anticaine, pipiacane, everything is same. Okay, and the drugs like the same thing of analgesic, like a commonly used one is the this thing NSAIDs, aspirins should be avoided. That is more important. All the NSAIDs are really contraindicated with the hepatitis and cirrhosis patients. So you must and in this thing you already mentioned the cost also avoid. But compared to other this one, no, we can give for these patients, but you must send the patient to the physician opinion according to the liver function test, then only we can give the patients. That's very important because normally most of the dental surgeons will give that paracetamol, all these things. Don't give it. Folks too we can give, but according to the dosage will be changed. Normally everything we are giving in 500 milligram like that only. So we will be avoided for the shape of the patient. Especially avoid aspirin like ibuprofen in developing patients with cirrhosis increase the risk of kidney damage with the NSAID. That is very important. And the antibiotics like penicillin, that also you can see is 250 to 500 milligram. Normally it's no 250 or 500 one like that. Safer dose, and it is no dose of the alteration needed before the hepatitis or the amoxicillin also same like that 250 to 500. And metronidazole, that is called a flagell, that is also the same thing 200 to 500. But in liver disease patient we can use metronidazole. Sorry, in liver disease patient we can give with the minimum compared to the renal. You already I talked in the class no regarding renal patients we can never give these drugs we can give, but in this case we can give, but the minimum dosage for the patients, that is very important. Next one is hepatitis. Hepatitis that are caused by the virus, like there are different types of hepatitis in A, B, C, D, E, and types like X and G are there. So the mainly the hepatitis like A is for infectious hepatitis from the fecal and oral matter, and B from the serum hepatitis, the parental route, C from the parental route, D also parental, E from the fecal and the oral. So what's in by hepatitis A? That is it's spread through the contaminated food and water and through the fecal and oral route. And vaccination is also available for the hepatitis A and fully recovery for this case. So the incubation period is 2 to 6 weeks and affects all the ages, and jaundice is the common one. And contaminated food already told. It never transmits from no mother to the child transmission, no subsequent transmission. Universal with the endemic and outbreaks will be there, and adults have more symptoms. They feel like symptoms will be there. So the main news source of news is crowded conditions, poor personal hygiene, poor sanitation, contaminated food and water, person and substance clinical infection for the food handlers. It's already studied in the general medicine. Okay. So these symptoms we can show in fatigue, fever, abdominal pain will be nausea, jaundice, weight loss, itching, and anorexia. These are the and abdominal pain will be there. These are the commonly seen in hepatitis A patient. So the differential the examination in blood test will be to IgM antibodies and IgA antibodies. You already know IgM and IgA respiratory IgG, but IgM will be in the lymph nodes. These are the main things. So, how will you treat now? We'll go for the non-drug therapy for the treatment. Rest according to the patient's level. That hospitalization, small frequent feeding for the calorie, and vitamin K injection if the proton is wrong. The IV fluid and electrolyte replacement and emetic drugs will be prescribed. Hepatitis B can be caused by acute and chronic infection. Infection may be last up to around 2 to 6 months with or without any symptom, and infected persons are able to pass the virus during these times. So the chronic hepatitis defines the presence of HBsAg for the 6 months or more than a acute infection. Incubation period is 2 to 6 months. Hepatitis B virus is produced within the antigen like HBsAg, hepatitis core antigen, hepatitis B surface antigen, and the independent protein circulating in the blood. Mostly is to the parental route. It's contaminated with the blood and IV drug use. Mother to child transmission is possible. High sexual transmission. These are the common. Also, further, this infectional exchanges mostly seen in the hospitals like that, uh, and occurs in all ages and mostly affects young adults in the worldwide cause mainly because of the cirrhosis, hepatitis, carcinoma. So the signs and symptoms for this hepatitis B is abdominal pain, dark urine, fever, joint pain, loss of appetite, and vomiting, and fatigue, and the jaundice. These are the signs and symptoms we can see. And the examination to the blood like SDLT, serum proteins, prothrombin, urinary bilirubin, urinary serum bilirubin, like that. And serological tests, HbSAg, and HbA, and the liver ultrasound and liver biopsy, all this. So the management for these hepatitis B is the severe hepatitis and liver function, also the rest vitamin supplements and avoid alcohol. And treatment for the chronic hepatitis A, there are nucleoside nucleotide like that, and sometimes liver transplantation also will do for this case. Is the hepatitis B virus, C is RNA virus, is 2 to 24 weeks or like 14 to 20. It's commonly Most common cases are through the blood and blood products contaminated uh, on the IV drug usage and dialysis patients. Both acute and illness will be hepatitis C, the liver cirrhosis, and there is no vaccination now at all. So I can test hepatitis C antibody and hepatitis C G and genotyping. So commonly it is transmitted to the contaminated blood and IV drugs. Mother to child transmission is possible, sexual transmission is there. Uh, so it is a acute this thing. And then also in journal it is everything we can see for these type of patients. So hepatitis C, E, everything will be there. So commonly we can see is hepatitis A, B, and C. These are pretty common things we see in the clinics also. The secret of the hepatitis B infection acute is, and if you're taking the antibody, then we can prevent infection. So most of the all the health workers, means in the dental and hospitals, they do the uh, vaccination for uh, vaccination. Only they can do because the chance of the high needle prick injury, that blood transfusion, everything procedure hospitals and the clinics. That's why they are taking the vaccination. So the carrier patient and the dental treatment is not contraindicated in simple or a super infected carrier patients. Always evaluate liver function test prior to determine whether the carrier patient has underlying hepatitis or cirrhosis. So suppose if the needle transmission hepatitis by a single needle is to 30%, and that is the reason why immunization against hepatitis B is trigger for the dentist and other working in the setting. C there is around less than higher than B. So that is why most of the all the dentists and the other doctors, they will do the supporting outside support vaccination. Then only we can reduce the infection rate. So this topic mostly you study about the what are the drugs we can use for the uh, hepatitis patient, like what are the drugs contraindicated, indicated drugs we can give to the patients, and what can be hepatitis A, B, C, and all these things. So this is the uh, topic. Uh, the drugs, everything we can do.